Hey, I'm Dr. John Minichetti. I am the president of the American Board of Oral Implantology / Implant Dentistry. And I'm here as part of our series of interviews with our board members for the year 2021. I am honored to be here this evening with Dr. Leon Berzin. Leon Berzin he's actually our past president of the American Board of Oral Implantology. He's actively involved in advancing the field of oral implantology. He's a diplomat of the American Board of Oral Implantology / Implant Dentistry, and he currently serves as our past president on the board. He also chairs the Part 1 written examination portion committee, where he's been developing test questions over the years, and he participates as an oral examiner during our oral examination process. He's also an honored fellow of the American Academy of Implant Dentistry, and he's past president of the Central District of the American Academy of Implant Dentistry. So, Leon, thank you for joining me this evening. So I'm going to start by asking a simple question. You've been involved with the board, the American Board of Oral Implantology, for many years. What do you feel is a benefit of becoming board certified with the American Board of Oral Implantology?
Well, firstly, I think earning the ABOI diplomate credential can make you a better clinician just by going through the process, preparing for the exam, self-critiquing your own work before submitting the necessary cases. I think you distinguish yourself from your colleagues when you earn your diplomate credential. You gain recognition from your colleagues and the public. You can become the go-to implant guy in your community. The ABOI diplomate credential, I think, can open up many doors, to different opportunities as you gain recognition in our field. For example, teaching, mentoring, lecturing, becoming an expert witness in medical legal cases if you're looking to do that. And I think our credential is really the only bona fide credential in implant dentistry. And in some states, you can advertise as an implant specialist. And we continue to pursue specialty status for our field, and we hope to make our esteemed credential even more relevant in the future.
Absolutely. I know in my experience, it really just made me a better clinician. And I know some specialists who said they've learned, surgeons have learned more prosthodontists by going through the examination and vice versa. So it's a very, very good vehicle for learning. So thanks for sharing that with us. So, Leon, another question I have for you as past president of the ABOI. You've been very involved with our boarding process for 7 years. I know you're chairman of the written examination committee. And tell us about the changes that have happened over the years, with the psychometric expertise that you have, and also to the format that we're undertaking this year.
So, as you've mentioned, I've had the honor and privilege to be part of this evolution of our credentialing process for a few years now. And I've seen the exams become more current, more evidence-based, and more psychometrically valid and reliable. We're now conducting the Part 1 written exam as a computer-based exam to ensure that our diplomates remain current at the highest standards of competency. We've implemented the maintenance of certification exam that diplomates as of 2016 need to complete and recertify every 8 years. And our ABOI diplomate credential is becoming more and more widely recognized. It really has been a rewarding journey to see all these changes for me personally, and I would urge all diplomates to stay involved in our field with the ABOI, become more active on the numerous committees that we have, the board itself, and be part of our bright future.
That's great. So I know this year the written examination is going to be given at testing centers. So that's a real change for us. Patients, participants don't have to physically come to Chicago anymore to take a written exam that was proctored, but now they could take it throughout the world at the Pearson View Centers. So do do you foresee something that's going to be done not only this year, but probably in the future too, that's done similarly with other certifying boards, even in neurology, et cetera?
That's correct.
Beautiful. That's a great opportunity, I think, for a lot of our candidates who couldn't travel, visas, flights, expenses. So hopefully we're going to have an opportunity for more candidates to challenge our board. Thank you for doing all the work with that. So you've been chairman of the written exam. What in our written exam really distinguishes a candidate that they're an implant specialist?
The ABOI's mandate is to certify individuals at the highest competency standards in our field. Our most current practice analysis, the psychometric analysis of our exam, and an evidence-based approach is what allows us to fulfill this mandate through our exam process. We conduct a practice analysis approximately every 10 years, where we describe the responsibilities of an ABOI diplomate via task statements, and a task survey of certified ABOI diplomates determines the overall importance of each task. We then identify the knowledge, skills, and abilities, what we call the KSAs, required for effective practice of these tasks, thereby establishing a link between the content domain of practice and content domain of our exam. And the results of the survey, coupled with the requisite KSAs, determine the weight of each area of the exam. So the exam committee devises questions that are evidence-based at the highest levels, referenced in the literature, and well-researched. A standard setting is conducted, and the exam is then implemented. Psychometric analysis then ensures that each question that is utilized in the scoring and the exam discriminates adequately between the less able candidate and the more able candidate. And then a pass point is set. So there's a lot that goes into the test construction, scoring, and ensuring that our results are psychometrically valid and reliable.
Right. Yeah, it's an incredible process. I know you've been instrumental in developing it, so I want to thank you for not only the profession, but the public in doing that. Thank you. So the next question, because a lot of candidates will ask this, they'll call the central office, they'll ask their colleagues, how can they best prepare for a written examination? It's a lot of information, and how did they prepare?
Well, I think being familiar with both the classic and the more recent literature is helpful. Previous clinical experience surely helps in discerning the right approach to any clinical scenario in your office and during the exam. The candidate should be well-versed in diagnostics, treatment planning, current surgical and prosthetic techniques, maintenance, and preventing and managing complications. All the questions are evidence-based, and the candidate should be therefore able to substantiate the responses in the exam. But we often just want to know how the candidate would manage a particular clinical scenario in their own practice. I always urge candidates to not overthink it during the exam. There are no trick questions. Don't try and think what the examiner wants to hear. Just let the examiner know how you would manage this particular clinical scenario if you were faced with this on Monday morning at your practice. That's all.
Very good. Good advice. So the American Board of Oral Implantology / implant dentistry is well known to many, but not everyone knows about this meaningful credentialing. So, and there's other credentialing processes and other organizations out there. What really differentiates our American Board of Oral Implantology from other implantology organizations or certifications?
Well, I think it's a good point to make first that I think it's important to clarify that the ABOI is not a membership association like, for example, the American Academy of Implant Dentistry. The ABOI is a credentialing body which was formed in 1969 by its sponsoring organization, the AAID. It is similar in concept to other credentialing boards of other dental specialties. The ABOI's mission is to certify individuals at the highest standards of competency in diagnosis, surgery, and prosthetic treatment in the specialty of implant dentistry and ensure their current knowledge and skills for the safety of the public. That's it. So the ABOI is recognized by the ABDS, the American Board of Dental Specialties, as a certifying board in oral implantology. And the ABOI Diplomate credential is the only really bona fide credential in implant dentistry. It is recognized in multiple states where ABOI diplomates are able to advertise as oral implantology specialists, and it continues to become more widely recognized. So there's really no other independent implant dentistry organization similar to the ABOI that administers an evidence-based, psychometrically valid and reliable exam, is recognized by the ABDS and numerous states to provide its diplomates with a bona fide credential in oral implantology.
So some of the candidates or potential candidates ask, why should they take this examination when it's not American Dental Association recognized specialty? It's the American Board of Dental Specialties. Maybe you can explain more about that, or more maybe about the history of the American Dental Association and recognizing boards, etc.
Well, I think the ABOI diplomate credential offers many potential benefits. The ABOI is recognized by the ABDS, as we said, as a certifying board in oral implantology. The ABOI diplomate credentials, again, really the only bona fide credential in implant dentistry, and is becoming more and more widely recognized. It is recognized in multiple states where oral implantology specialists can advertise as such. You distinguish yourself from your colleagues when you earn your ABOI diplomate credential. You gain recognition from colleagues and public, and you can become the authority in implant dentistry in your own community. It can lead to other opportunities, as we've mentioned. You may wish to pursue teaching or becoming an expert witness in medico-legal cases. We also have many specialists in oral surgery, periodontics, prosthodontics, seeking our credential, achieving dual board certification to gain more recognition amongst their communities and referral bases. So, in saying all this, our quest to take the field of implant dentistry to a recognized dental specialty and our efforts to enhance the relevance of our credential will certainly continue to be actively pursued.
So, yeah, I'm gonna give you a last question here. Okay, so it's a personal one. So for Dr. Leon Berzin, how has the ABOI positively affected you in both your practice and your professional career?
I've personally very much enjoyed the process. I think it probably made me personally a better clinician. The recognition from my peers and the public has enhanced my practice, opened up doors that led to other opportunities. And serving on the ABOI board of directors has been a real honor and a very rewarding experience working with you, our terrific colleagues on the board and on the different committees to further the ABOI's objectives. And again, I'd urge anyone considering it to challenge the board, open up doors to new opportunities, and really enhance your professional life. And I urge all diplomates to stay involved in our field with the ABOI, become active on the various committees and the board of directors, and become part of our promising future leadership.
Beautiful. Well, thank you, Dr. Leon Berzin.
Thank you, John, and thank you for all you do and leading our board into the future.
Of course, it's a pleasure to follow in your footsteps and an honor. And thank you for your past service and for your service this year and your continued service, I'm sure, with getting our participants or applicants into board certification process. So that concludes this interview with Dr. Leon Berzin, our past president, American Board of Implantology. If you have further questions, of course, you can go to our American Board of Oil Implantology website at aboi.org, or you can call our central office and speak to our executive director, Kathleen Hutton, and ask her any questions. She's available 24 hours, 7 days a week. I'm just kidding about that. But our website is. So thank you for the interview, Leon. Have a great evening.